Hello again. I'm Justin the Wizard. I'm dealing with a shoulder injury today, and as a result, I'm going to be taking my notes a little bit lower level on my desk, closer to my reach zone, to help accommodate for this reduction in my spell energies. Uh, so, my apologize for reduction in eye contact. I'll still do what I can to be present in the video. For those of you that are watching us here on this podcast. And anyway, so back to kind of the normal routine. I'm a nationally board certified health and wellness coach, and I'm going to start with a optional mindfulness exercise that is an invitation for everybody that is comfortable with it to participate in. And if you need to disengage at any time, we always understand because mindfulness is a very personal experience that everybody should engage with at their own level of comfort. So, with that, again, I invite everyone to close your eyes if you're comfortable doing so and visualize, if you will, your place in space and time. We are made of star stuff. It is okay to imagine ourselves amongst the stars, for we always are amongst a star. When you feel the warmth of the sun, that is the glow of a star reaching your place in space-time. So now, continue to float through space and time in your mind's eye. And when you're ready, return back to here and open your eyes to enjoy this episode of our Fairly Magical podcast.
Yeah.
Again, I'm Justin the Wizard, nationally board certified health and wellness coach, joined by Elena.
I'm Elena Lunt. I'm your chaos coordinator here. And yeah, thank you for that mindfulness exercise. I needed that. I've been going a million miles a minute all day, and that was an excellent reset. I love it.
Hoped it would be. Glad it helped you.
Yeah, sure did. And it matches the deck that I've pulled for today, interestingly enough. So we're going to be starting with the Starcodes Astro Oracle by Heather Roan Robbins. This is a really visually stunning deck. I'm going to show you the backs of the cards. My camera will cooperate. Maybe a little bit. They're
I
really,
see it
really
like a
neat.
compass rose with like a rainbow
Yeah,
around it. Yeah, a spectrum around
yeah,
it.
yeah. Lots of sort of clean lines and bright colors in this art. So we're shuffling our oracle deck with our intentions in mind. And what kind of adventure are we being led on today? We've got Chiron representing healing. We have the Ascendant representing entrance. And we've got Taurus to cultivate. Cool. All right. So we've got healing, entrance, and cultivation leading us to.
Healing is such a part of what we're doing in general. Uh, I hope that over time, this platform, this podcast becomes a entrance point for many to something that was needed to be heard. For now, we're cultivating that hopeful intention. What are your thoughts?
It's neat. I mean, I do see that for sure. I see this, um, as an entrance point for people wanting to learn more, perhaps about certain topics, and we usually provide links to helpful resources for things like that for people who want to learn anything more about what we discuss, because we're not complete experts, but you know, we like to run our mouths, and we are we are
Are you yapping?
cultivating that. We're yapping. We are cultivating our yappers. Look at us go. Um, yeah, and it is a definitely a healing process, and a lot of the topics that we're tackling here are related to health and healing, whether that's mental, emotional, or physical, or all of the above, as
Um,
a lot of things seem to touch on.
oh yeah. Oh yeah. And we were noticing as you were sharing the art, I made a comment about how it's kind of like a spectral art pattern around.
Mm-hmm.
Uh, was it the back of the box or
Yeah, these are
one of
the
the
backs
cards?
of the cards.
Yeah. So, uh, what caught my attention was actually immediately for reasons of watch our previous episode, and you'll know why the spectrum might have caught my eye immediately. But the reason why that's also really salient for me today is that I kind of came in thinking about what I wanted to talk about today, uh, and we mentioned very briefly when talking about Avast before. We mentioned very briefly that we acknowledged the spectral status of things like autism. And in noting that, other spectral chronic conditions come to mind for me. Uh, and specifically, I deal with a, a syndrome called Ehlers-Danlos syndrome. This is actually not one condition. This is a collection of disorders of the connective tissues. And Ehlers-Danlos thus presents in multiple different ways and has various different symptoms. Many of the different specific versions of Ehlers-Danlos have symptoms that present similar to other versions. Many of them can be tested for with like a genetic analysis. They can actually check for chromosomal distinctions that identify several of them. Um, However, lacking that type of um, signature in your symptoms that points to one of those, they are unlikely to actually, in at least in like traditional standard primary care, you're unlikely to get that type of diagnostic pursuit. In my experience, you're more likely to, um, and especially because the most common version of Ehlers-Danlos is a version called hypermobile EDS. Um, in hypermobile EDS, there is a characteristic joint laxity. And so one of the signatures, for example, is the ability to go past and like kind of have an extreme ability to go past the point of straight on a joint. Um, and my knees can very much go like past the normal straight up and down point and sort of like be bowed backwards. It's not uncomfortable for me. It's just like when I lock my knees, they're actually like way behind where they would be for normal uh, unaffected knees. Um, and so this is a joint laxity issue. Now, for me, I also have a presentation which is muscular stiffness, and that is created by really what's happening in Ehlers-Danlos is a stickiness of connective tissues. They get stuck together and then can get bound up, or they can be dysfunctional in other ways that lead to them being extremely relaxed. Or if they get stuck together and then stretched out, they can be so stretched out that they don't hold your joints together anymore very well. So very extreme presentations involve joint laxity of basically like every joint in the body is something I've anecdotally heard about. And, we also have things that are part of the Ehlers-Danlos experience that are kind of like novel versions of having allergic reactions, not the standard antigenic reaction that most people have seasonal allergies based on, but it's instead something called mast cell activation or mast cell activation syndrome. And that is um, a certain type of immune cell that is involved in creating this type of secondary allergic response. It's a normal part of our body's immune system, but in people with a certain connective tissue disorder, it affects those cells in a way that causes them to dysfunction and attack our own bodies in ways that are very unhelpful for the people dealing with it. And so uh, some of the things that people with the same, so I'm now referencing a specific set of graphics. And the first one, and I'll make sure to put it up on the screen, this comes from the Ehlers-Danlos Society. And so there's like a Venn diagram, and they're comparing three different types of EDS. And we don't need to worry too much about what the different types are. However, if you do suspect that connective tissue disorder could be a problem that you deal with, I encourage inspecting the Ehlers-Danlos Society's website for more information about what these are and whether they might apply to you. Some of them are very serious and potentially life-threatening, but that's not to be alarming. That's just to say if it affects your like blood vessels, it can be life-threatening. So people with brittle blood vessels as a result of this condition need special treatment. And that's the condition that I'm referring to, which is called vascular EDS. And that's the only one that I'm actually like particularly interested in flagging as a large concern for life. The
Yeah.
others are debilitating, but not necessarily likely to lead to a life-threatening state. So that's what I wanted to say about EDS generally before going forward with this. But anyway, this Venn diagram compares actually vEDS to cEDS, which is classical EDS, and kEDS, which I don't remember what the K version is referring to. Um, but it might be kyphoscoliosis, which is on the Venn diagram. Um, I don't know that for sure. It's just a guess based on the K word that I'm seeing there. That's unique to that part of the Venn diagram. Venn
Mhm.
diagrams are great because they allow us to have discussions that are meaningful about comparative, you know, comparative dysfunctions between different conditions that have some overlap. One of the classic Venn diagrams that I find helpful when I'm coaching and somebody presents as neurodivergent but undiagnosed. One of the resources I like to share with people like that, with permission, is I will refer to Venn diagrams that show the comparison between obsessive compulsive disorder, ADHD, two conditions which I am diagnosed with, as well as autism, a third thing that overlaps with those first two heavily, and which I also identify with but lack the diagnosis. And so these comparative Venn diagrams are very good at helping to uh, provide patients that potentially are dealing with these conditions with resources to help them figure out which direction to discuss things with their doctors if they need treatment for things. And some of these conditions get more treatment than others. So keep that in mind. Any thoughts before I keep
True.
talking about?
I mean, I love the Venn diagram or the sort of visual graph of some sort as a way of comparing things or um, sort of measuring intensities of symptoms or different ways that conditions can affect the body because there's such a huge range of a normal presentation of any of these things with such a long list of potential symptoms that somebody might experience, this one and this one, but not that one, and maybe just a little bit of that. And it's
It's like
just,
it's an inventorying tool in that way,
yeah,
right?
yeah, it
It
is.
helps you take
It
a
is.
personal inventory of your symptoms and presentation for yourself.
Yeah,
Helps you get that language right for your care team, whether that's a doctor,
yeah,
therapist, psychiatrist, whoever it might be. Um, that's ultimately where you're going to be able to get the help is from those medical experts that can
right.
provide diagnostic and then prescriptive care, which is
Yeah,
that's the set of things that coaches absolutely don't do. Diagnose and prescribe
no,
are the things that coaches can't do in that scope. Um, so, a coach is always going to be limited to referral in that specific context. There's just nothing else that can be done but say you're going to need to talk to a doctor about getting further help with this. All I can do is maybe show some resources and share information. But the Venn
right,
diagram is a good first pass tool, but it doesn't help I actually want to kind of not really disagree with you, but I just want to counter one thing you said, which is like intensities. I don't think the Venn diagrams achieve that, but
right.
there
The
is a
Venn
tool that
diagrams
does.
don't, but yeah, visual graphs in general,
Right.
they can be used for
Yeah. No. So on the same page as this Venn diagram that compares these three versions of EDS, and so I'm just going to real quick say like all three versions of EDS that are compared here have easy bruising and joint hypermobility part of the experience. In fact, basically every version of EDS includes joint hypermobility as part of the presentation. Um, Hypermobile EDS is the diagnosis of kind of elimination when they don't have any other reason to diagnose one of the other things. Uh, and so hEDS that I'm diagnosed with is distinguished from these others in that there's no genetic test. So if they suspect that that's your diagnosis, then they're not really going to spend resources on seeking information that's not going to really help them confirm anything. It just would help them confirm that you don't have those other things. Um, so the nice thing about the Ehlers-Danlos specific set of conditions, like I'll take classical EDS, they look for two specific things as part of that presentation, and I'm not going to even attempt to pronounce the first one without embarrassment, but I can certainly pronounce subcutaneous spheroids, which is basically saying, I want to say that's basically a cyst. Um,
Yeah, that sounds like a spheroid
so,
under the skin. Yeah.
yeah, and so then classical EDS and kEDS share the experiences of things like hernia, atrophic scarring, which is scars that form pits
Hmm.
in the skin. You'll see people after they have chickenpox will actually often form this type of scar specific to that condition that has nothing to do with EDS potentially, but may have something to do with EDS. Um, that's that's an iffy thing where there are other reasons why you might scar that way, specific to like what you were scarred by. So keep that in mind.
Right. Yeah.
Um, but anyway, the other thing that's shared between C and K EDS is stretchy and fragile skin, or they also
Mhm.
say velvety skin, is one of the things that I've uh, heard. And then kEDS, I mentioned the K might refer to, I think the word is kyphoscoliosis, which is basically referring to scoliosis, spinal uh, misalignment,
Spinal
ver-
curvature. Yeah.
spinal curvature, vertical misalignment. And then low muscle tone is the other thing associated with kEDS that's kind of unique to that one version of EDS. If you have that presentation compared uh, to the others of that scoliosis and low muscle tone, as opposed to the subcutaneous spheroids and what they call, I'll try it, molluscoid pseudotumors. I don't know what that
Okay.
is. So this is where like I really needed to defer to doctors when I'm
Hmm.
looking for more information about conditions. Even myself, when I'm looking for help with my own health, I still have to go to the doctor and ask questions about like what does that mean? Can you tell me what these words that I found in my research mean? But you'll get good answers from a doctor. That's the thing that I've learned. You go in with a specific question, they'll give you a specific answer.
Yeah. But
Now I'm going to start
yeah.
comparing to vascular EDS. But do you have any questions or comments
Oh,
before I
I was
go?
going to say that like knowing which questions to ask is often half the battle. And, you know, having the correct language to ask the question in the right way to get the information that you need um, can be tricky.
Totally. So vascular EDS, this gets to some of the symptoms get to sounding kind of scary. It is the one with the life threatening concern, the potential rupture of venous tissue. It's not fun. It's life threatening when it occurs in the regions closest to the heart, what we call the aorta.
Mhm.
That's what's really life threatening about it is that patients with this condition will sometimes suffer from kind of a spontaneous hemorrhage in the chest, and
Well,
it's not a good thing to have happen, obviously. So now there are some other things that identify it. It shares that particular problem of like aortic rupture and arterial rupture and stuff. That is actually common with kEDS. Same with things like congenital hip dislocation or clubfoot. I've heard of clubfoot before, but I can't remember exactly
Mhm.
what it refers to. But um,
I think it's the feet being sort of turned in, um,
yeah,
or
that
like
sounds right.
like one foot being misaligned in some way.
Yeah. So anyway, basically, there's a lot of alignment stuff related to this kEDS that, again, I don't really know a lot about that version of EDS because I haven't had any reason to deep dive into it. I don't present that way. Um, but if you do have like a kid, like it seems like your hip's always acting up and you've had scoliosis since you were a kid, and you have a hard time putting on muscle tone, maybe you now are hearing this and you want to go talk about like, hey, what is this kEDS thing, and is it worth getting a quick genetic screening for it to make sure I don't have this that explains these reasons? Could this be the reason why I'm having this easy bruising, weird scarring, and uh, stuff like that? It's worth asking. Um, And so now vascular EDS has some things that are unique to it. Um, Separate from like just your blood vessels in vascular EDS, some organs will actually be prone to also organ rupture and things like that. So um, it's just one of the various risks of this particularly high threat condition, uh, where it's important for people that have it to have it identified. I would think you'd be showing some health issues pretty early in life if you had the genetic predisposition to vascular EDS, because the the symptoms are so severe, um, and life threatening in some cases. Um, there's also a few things that I'm not sure exactly the medical meaning of pneumothorax or carotid cavernous sinus fistula. Talk to a doctor if you think those terms might apply to you after researching them on a trusted website. Something like Mayo Clinic could help you to get definitions of these terms that are coming out of my mouth because they're on a graphic that I'm reading off of a website. So just please keep in mind that I'm not the right expert to define all of these terms for everybody, but I do have experience that helps me speak to the specifics of the next graphic that I'm going to talk about, which is same page as this Venn diagram that compares different versions of EDS and helps you to figure out which of these different things may or may not apply to you. There's a pair of what I call radial graphs, or you might call pie graphs. And these show intensities in different slices of a pie chart, where emanating from the center radially, uh, each color coded symptom for, in, in this case, it's hEDS, which I do know about. I have hEDS, um, which is Ehlers-Danlos syndrome with hypermobility, or hypermobile EDS. And there's also hypermobility spectrum disorder, HSD. I've heard that these two conditions are being diagnostically merged together in soon. Question mark soon.
Okay,
I heard that somewhere. I hope that happens
interesting.
because that could help ease the path to Ehlers-Danlos diagnosis for people that have the hypermobile presentation. Um, but anyway, so in these radiographs, or a good example and a cultural touchstone is in Pokemon Sword and Shield. You can take a look at a Pokemon stats using a graph like this, and it basically is showing like how intense, how far from center is each statistic, how much of the um, that way of being, um, how much of that signal is present. And so it sort of fills in with color. And an example is in person one with uh, hypermobile Ehlers-Danlos syndrome. Um, you might have 3 out of 4 for pain and 3 out of 4 for that allergic response, mast cell activation syndrome. In a person two, they might be 4 out of 4 for pain and 0 out of 4 for the mast cell activation. So there might be no signal of mast cell activation syndrome. That doesn't mean that the second person doesn't have hypermobile Ehlers-Danlos syndrome. It's like I love my tongue. Sometimes it betrays me. Uh, but the point is, you don't have to have every single symptom of a condition to be diagnosable with a condition.
Right.
Uh, and some of the things that are also in this theoretical comparison, um, I like the term dysautonomia. This refers to autonomia, which is the autonomic nervous system's actions that it performs for your body. That is
Mhm.
all the stuff that your brain does for you automatically, like keeping your heart beating and lungs going when you're not otherwise thinking about it. Um, Also, it's things like keeping your tongue in place. It's things like um, just allowing your GI tract to digest food and all
Yeah, I
the.
was going to ask if digestion would be part of that too.
Oh yeah, very much so. And so, dysautonomia is also going to have to do with the bladder a little bit.
Right.
Quite
Yeah.
a lot, actually, quite a lot. In fact, one of the things that I've struggled with has to do with like bladder dysfunction as a result of my EDS, where it's almost like I've got, for a while, they kept testing me for UTIs, even though it was always like, seems fine. I don't think you need a antibiotic. It's like, yeah, well, I didn't think that either. I just think that um, I'm getting signals that are telling me to go. And so I can actually take for that, I take a tricyclic antidepressant uh, right before bed that helps to support my autonomic nervous system with neurotransmitters across the spectrum. Tricyclics are different than SSRIs and SNRIs that we talked about before, in that
Hmm.
tricyclics kind of do some of the same stuff. They prevent reuptake of neurotransmitters, but they don't really target any neurotransmitters at all. They kind of do it to all of them. So
Okay.
it's a little bit of a different and more sedative effect. We have a neurotransmitter called GABA. And when you prevent reuptake of GABA, you're going to get sleepy, guaranteed. Um, and then the other thing that helps me with pain related to my Ehlers-Danlos, which also often gets diagnosed as fibromyalgia. Uh, so that's worth noting. Is you might have a fibromyalgia diagnosis now. That doesn't mean you couldn't also get a EDS diagnosis if you have some of these other
Hmm.
presentations that are also there. But anyway, the general chronic pain experience, I treat with I mentioned GABA just a second ago. There's GABA analogs are a drug class that includes gabapentin. A lot of pet owners might know gabapentin because your vet
Yeah, I
might
was
have
like, I know that
prescribed
one.
it. It might have prescribed it as the sleepy inducer for your doggos or something like that, before going in for the more disruptive veterinary procedures. So gabapentin has a lot of people know it from that type of space. I knew it from that before it was prescribed to me as a human. But anyway, gabapentin actually, when I take it, I have a few minutes before I'm going to fall asleep. So it really is a great help to me in terms of coping with this condition because uh, it allows me to sort of take something that's gentle in terms of side effects on my system. Um, not that it's no side effects. Gabapentin has side effects. I'll talk about those in just a second, but it's gentle on my system. Um, and it is a reliable way for me to get deep sleep again.
Yeah.
And anybody with fibromyalgia knows that getting sleep is extremely difficult when you have that condition for any reason, whether it's EDS or otherwise. You could have many reasons that could cause fibromyalgia. EDS is one of them. Um, but anyway, so gabapentin, it's not all great, and it's not for everybody. Um, it causes vision disruptions, even in me, and I tolerate it pretty well. I will occasionally, if I do wake up while I've taken gabapentin, I'll notice that my vision's sort of shaking, almost um, like I'm in a vehicle on a bumpy road sort of vision, but I'm stable. My eyes are
Right.
doing it. And so it's what it's doing is it's like affecting our nervous system. Those of us that take it, it's affecting our nervous system in ways that are sort of not intended to be awake for.
Right.
And so that's kind of the experience of being awake during while your optic nerve is in REM, is what I would kind of say.
Yeah.
Based on my own experience, it's like I was kind of awake, but my eyes were still in REM sleep mode. So they were sort of doing that rapid eye movement thing, and I was perceiving it because it was like a not a time for me to be awake. When I did start taking gabapentin, one of the things that was super incredible for me about it was that I started dreaming again. Uh, I lost dreams for years, and I didn't know where they went. Um, Gabapentin allowed me to dream again, so
I like
that was cool.
that. Yeah.
Your video
Yeah, that is
sort of
that is
stuttered
really
on
good.
us,
Yeah, I caught that
but
too. Don't know what that was. So,
but anyway, we got the intention of your sentiment there.
yeah. Yeah. I mean, rest is so critical for the body, and anything that's gonna get you there is definitely gonna be worth it. I think.
Mhm. So the last thing is on Avast. There's a way to present the autism spectrum, not as a line at all. In fact, spectrums really in health shouldn't be lines. They should be this type of radial pie type graph most of the time, where they sort of show a person's relative presentation of individual symptoms that are known to be associated with the condition as a spectrum.
Mhm.
So that you can sort of identify where that person sits on the experiential, you know, level. So for autism, this includes things like on this spectrum, I'm going to include eye contact, social issues, or I'm just going to read around the wheel. Eye contact, social issues, sensitivity to noise, textures, light, the need for routines, um, executive function or dysfunction, relative levels of executive function, basically. And hold on while I rotate this around. And then communication problems. Uh, just because you're diagnosed with autism doesn't mean that you're going to have communication problems. Um, so I'll talk about kind of how I feel about myself in some of this spectrum wheel in just a second, to help people understand why I kind of identify with the autism community without necessarily having the diagnosis myself. So I'll just get to that. But um, restricted interests is another one of the pie parts for autism. And then
Mhm.
anxiety, stimming. Um, we can talk about stimming in just a second. And then meltdowns.
Yep.
So, yeah.
Yeah.
Thoughts?
So a lot of that is very familiar to me, um, being that one of my children uh, does fall on the autism spectrum, and uh, we certainly see um, a lot of those behaviors, a lot of those sort of difficulties. They struggle particularly with social cues and understanding things like um, sarcasm and like teasing out of love. That kind of thing can be very, very difficult for them. Uh, but yeah, and then we don't see as much of some of the other things you mentioned there. But yeah, the special interests, we have very narrow interests. Um, but you know what? That's fine. We're just gonna keep catering to those interests, and you can love what you want to love.
Yeah, no, that's the thing is like if you got special interests that you like to indulge in, it's okay. Um, I I have a special interest in video games where I like am a pilot of giant robots. That's really something I spend a lot of time doing. I don't expect
Sweet.
everybody to be into that, but it's cool. A lot of people might think it's cool, but not also like want to do it with me. Right? It's like kind of both things are true. Um, anyway, so I definitely have always experienced like the restricted interests component of this. Um, I'm generally less interested in something because it's offered to me from the outside than I am if I uh, have taken to it, if that makes sense, right?
Right. If you've discovered it yourself, kind of thing.
Yeah, and so uh, yeah, I definitely have the anxiety experience, 100%. Like that's well, not like 100% anxiety out of like not on the scale, but just I absolutely experience anxiety probably at like a level, if I'm honest. Um, now stimming, I'm like a 10. My knees right now are just like going. I, I just kind of one of the reasons why I sit on a ball in the first place is um, and I sit on a ball. So that's why I don't have a back of a chair here, and that's why I'm like also like able to bounce up and down and stuff like that. I'm not on a chair. I'm on a physio ball, so that helps me to have a constant stimming activity while I'm at my desk and
Mhm.
working, so that I can keep that part of my needs constellation satisfied.
Yeah.
Uh,
For my kiddo, we've found that adding a bounce band to the bottom of their chair helps a lot with um, being able to sit through meal times, and not sort of getting distracted or losing interest and having to go move around. Having that bounce band is awesome.
sure, whatever works. I'm not sure I understand how that's being used, but I'm glad that it's working. Do you want to spend more time on that?
It's it's like a very thick, heavy duty rubber band that
Hmm.
has two sort of openings on either end that slip over the two front chair legs. And then it's a band running parallel to the floor that they can bounce their feet against. And that gives a lot of sort of sensory feedback and allows for movement and stimming while remaining seated.
Well, that makes sense.
Yep, it's great. Love it.
Yeah, my like I had certainly I like the idea. I think it would work, even for me if I was the kid in that situation. I think I'd love it. Meltdowns aren't something I've ever really intensely identified with, but that doesn't mean I'm immune from breaking down and having outbursts at others. Like, um, it's not something I'm proud of. It's not something I like doing, but it's something that happens and that I'm gentle on myself about, um, because I am human still.
Right. Like it's not a hobby. You just
No.
sometimes reach your limit.
Right. And sometimes I don't communicate about having reached my limit in the most graceful of ways. And that's kind of how I view meltdowns here. Now, eye contact, I struggle with eye contact in person on Zoom. I've noticed in watching myself in these videos that my eyes are all over the room. And that's got to be just part of dealing with me. If you're not me, uh, I imagine that uh, just gets gotten used to. And I don't really actually notice very often if other people are making good eye contact with me. I lack that particular awareness. I don't really care. So that's where like social issues and picking up for like social cues comes in. It's like, yeah, if you're identifying with autism, you're going to be missing some social cues. Okay, like you're gonna miss some stuff. You're going to be in your own head uh, once in a while, and that's just part of the experience here. It's not something you need to take hard. It's just something that you need to take in stride. Now, and sensitivity to noise, light, texture. This this is why these radial pi graphs are excellent. Is that they help you to think about all these different factors. And for me, this is one of the biggest things. When I was a kid, I would surgically go around my, like if I was served a steak, surgically removing all of the fat, all of it from the steak, and eating only the meat part, the lean meat part. And I would get a hard time um, for not being able to handle that texture. Um, Earlier this evening, I pulled up a window and on my computer, and it was like really bright white to access these charts and resources. And that's fine. That's part of the one of the hazards of the job, um, working at a computer for me. But I certainly am a dark mode person, uh, where it's going to be much easier to find me in a um, less lit room than it is in a brightly lit space. I kind of need routine, but I'm ADHD enough to break that particular part of the spectrum. And executive function is a problem for me in a lot of ways, not just because of the potentially autistic experience, but for like other reasons.
Right. Dealing with other kinds of chronic conditions.
Yeah. And so, again, autism, we were very quick to say autism's a spectrum, and we all understand that. Well, I hope this video stands to enhance that part of the discussion a little bit. Um, and as I'm looking forward to resting my shoulder, do you have any other thoughts before we? before we go?
I mean, I'm just looking at these cards again that we pulled for this reading, and yeah, I mean, I hope that this has been an entrance to cultivate more knowledge toward healing. We did it.
We did it. I'm Justin the Wizard, National Board Certified Health and Wellness Coach.
I'm Elena Lunt. I contain multitudes and at least one raccoon.
At least one. Okay, bye.
Bye.